My name is Nicole Hablitzel. I'm a D1. I'm working with another D1, Diarmid Hall. Dr. Hung is our advisor and PI. The working title of our research is Student Perceptions of COVID-19's Effect on Dental Education. Diarmid and I are interested to see how the COVID-19 pandemic is affecting dental students. We are interested in students' physical, mental, and financial health in regards to the pandemic, and also in how schools around the United States have responded to the pandemic and how successful their students consider the institutional responses to be in terms of their education and safety. Not much research has been published yet on this topic. We read a paper that was published by Roseman faculty titled, "In an Era of Uncertainty, Impact of COVID-19 on Dental Education." This was published by the Journal of Dental Education in September. In some ways, we hope for our survey to be a continuation of this research. The difference will be the research in this study was completed at the time of dental schools closing and reopening. Our research will focus on student perceptions of how dental education has changed from last year to this year due to the COVID-19 pandemic, and how effective students feel the measures taken by the school to be. Our methods. This is very much a work in progress. Currently, we have just begun the process of filing for approval of the IRB. After we receive approval, we will send out an electronic survey to all current Roseman College of Dental Medicine students by email. The survey will have around 40 questions and will be able to be completed online at the student's convenience. Most of the questions will be answered by selecting a response. We also hope to include a few open-ended response questions. The survey will be anonymous, but we would like the names of students who participate to be entered into a raffle to win a gift card to increase participation in the survey. The exact details have not been worked out yet. So what are we going to ask in the survey? As there is not much research on this subject yet, we realize that there are a lot of different directions that we can take this project. We started by trying to narrow down exactly what we are interested in and what we want to ask students. Currently, we have a list of over 100 questions, and we have separated these questions into different domains. Then we read over the Roseman faculty paper and compared our questions and domains to those in the paper. From here, we have made a working copy of questions from both papers, and we'll select the best questions from these. These are our domains. They give some examples. For basic demographic questions, we want to ask students what their age is, the type of household they live in, whether they're single and live by themselves, single with a roommate, with a spouse, or with a spouse and children. We'll ask their year in school and whether or not they whether or not they've tested positive for COVID, or if a close family member or friend has. For student physical health concerns, we will ask things like how likely a student thinks they are to get COVID from being on campus. For an assessment of protocol considerations, questions like how effective students think it is to screen students in the morning. For an assessment of institutional responses, how students feel about the transition to online classes, and then a lot of questions about student academic concerns. I am particularly interested in student academic concerns, an assessment of school protocol considerations, and institutional responses. These questions have to do with how students feel about COVID testing and getting a vaccine. I am very interested in seeing if there's a difference in the perceptions between D1 students and D2 through D4s to the changes in didactic courses and the time they spend in clinic seeing patients. Diarmid is very interested in mental health questions. So depending on how we finalize the questions, we hope to write either 1 or 2 papers, and they could be separated by these categories. These are examples of our questions. They are all structured very similarly, and we tried to make them very easy to answer. We want students that start the survey to finish it, and we really want to get some honest feedback. And we hope that how the questions are formatted are going to help with this. We will potentially include some open-ended questions as well. We're genuinely interested in We're genuinely interested in learning how dental schools can make positive, permanent changes from what we learned during the COVID-19 pandemic. And we feel that students will be motivated to answer questions like this.
Hello, my name is Diarmid Hall, and I will be talking about our anticipated results, discussion, and potential conclusions. Overall, due to the pandemic, we are expecting to see a decline in health in the majority of our surveyed categories. For mental health, we expect to see a decrease. However, we're more interested in seeing what factors play a role in this. For example, some students may say decreased social experiences were largely impactful on their mental health, while others may not. We're expecting that factors such as having children or living relatives will increase stress. For physical health, we're expecting to see the majority of students are worried about contracting COVID-19 and are going out of their way to reduce their exposure. Even if the students themselves do not feel they are at high risk, they may be worried about catching and transmitting it to others who are high risk. For financial stability, we're expecting to see students taking out more in loans. We're curious to see if the inability to work will result in more financial stress. And even for students who do not work, the pandemic can affect someone they rely on financially for support, such as a parent or a spouse. We're expecting to see a decrease in overall satisfaction with distance learning compared to in-person learning, as the majority of people are more familiar with in-person learning. Dental school requires a lot of hands-on work compared to other medical professions, and this poses unique challenges with online learning. We're hoping to learn about how students feel the institution dealt with the pandemic as well. One area we're interested in are the aspects of distance learning that students thought were beneficial and should be added to the regular curriculum. One we have is that recorded lectures allow students to watch at their convenience, and they can pause and rewind, giving them an advantage to pick up material they may have missed. Another is Google document containing questions students type out to ask their professors. These have become popular as they allow a consolidated place for questions and can be filled out at the students' and professors' convenience. Another thing we're interested in is how the students thought the school handled the pandemic. These questions are going to have a broad range of responses, rating the school's perceived effectiveness. People can say what they liked, didn't like, what could have been done better. One example being the mandatory weekly testings we're going to have starting spring semester. Do students feel this will be beneficial and make them feel safer on campus? Do they not think they'll be beneficial? Do they think they should have been done earlier? We're also curious to see the impact of the pandemic across the different dental classes. This will be interesting to quantify as each class has had unique experiences due to the fact that Roseman is such a young dental school and is undergoing changes every year. Being able to look at these results will allow us to differentiate which classes are adjusting better to the policies that the school has laid out. Finally, we're curious to see if people's post-graduation plans have changed and if they have any concerns about finding a job. Some students may not be worried at all, while others may consider specializing because interest rates are historically low and they could ride out the rest of the pandemic in school. Once again, our goal is to see how the pandemic is affecting students at Roseman. After obtaining this data, we're hoping we can present it to administrators at Roseman University College of Dental Medicine, and they can see how students are doing during the pandemic and which responses students believe were beneficial or detrimental to their learning and health. This could potentially lead to better policies in the future and overall improve the quality of dental school education. Depending on how this survey goes, we may modify some of these questions and try and include other schools in the future. This would give us a better understanding of how dental schools overall handled the pandemic, and the ability to compare between schools would really show which policies were effective and ineffective. Thank you for watching our presentation.